Hi, this is Dr. Peters, and one of the questions that I wanted to take a minute to answer in the video is, why is neurological testing so important? Well, the reason it's important is because when we have nerves that are damaged, the purpose of those nerves is to actually convey information from the tissue and from the skin and from the joints up to the brain. Some of these nerves can actually travel as fast as 268 miles an hour, as fast as a NASCAR race car. And when that information gets blocked, it doesn't reach the brain, then you lose what we call proprioception, which is from the Greek language, which means sensing one's own. And it's essentially how you know if your thumb is up or down without having to look, because those nerves go to your brain in a millisecond. And now what happens when you have neuropathy is those nerves get blocked. So how we measure that, an easy and non-invasive way to do it, is we utilize a tuning fork. And this is a 128 hertz tuning fork, and we put it on a specific area. And we measure that compared to an area that's normal, for example, the clavicle, which is very rarely, if ever, lost or deficient. We compare that to an abnormal area, and what we usually find is that the sensation is usually less. And so the patient can grade that. And the way to think of this is like a hearing test. It's exactly like doing a hearing test where you measure decibels, you measure sound. We're doing the same thing utilizing these receptors in the skin and in the muscles and joints. So that's why a neurological exam is so important and so critical for patients with peripheral neuropathy, and it can identify what may be causing your problem or condition. Now, the second question, the second important part is, when we find out what may be causing it, we need to treat that. And so in order for somebody to stay better with neuropathy, if you're a diabetic and your blood sugar is out of control, for example, and you may not be, it may be something else, but just using that as an example, in order for you to stay better, we have to lower your A1C and what we call your glycemic index markers. And when we do that, that lowers your risk of having nerve damage. The risk of nerve damage, by the way, starts when your A1C is only above 5.6. And so that's why patients come in and they're many times pre-diabetic, and that is enough to damage nerves. That's all it takes. And so studies show that, studies correlate with that. Okay, so I hope that helps. Thank you for watching this video.